Assalamu alaikum. My name is Alia Zahra and I am a student of MS Chemistry. Today the topic of my presentation is male and female hormones disorder. So let's start it. First of all, what are hormones? The word hormones originally derived from the Greek language. It means setting in motion. Hormones are chemical messengers that are secreted directly into blood and which carries them to organs and tissues of the body to exert their functions. There are many different functions of hormones. Some of them is given as first of one is development and growth. The second is metabolism of food items. The next is sexual functions and reproductive growth and health. The other is cognitive functions and mood and maintenance of body function and thirst. The question arises here, from where these hormones secreted? The next answer is that the endocrine system is a network of glands that produce and release hormones that help control many important body functions, including body ability to change calories into energy that power cell and organs. The endocrine system influences how your heart beats and how your bones and tissue grows, and even your body ability to make a baby is play a vital role in whether or not you develop diabetes, thyroid disease, growth disorders, sexual dysfunction, and a host of other hormone-related orders. The next is how the glands are ductless. So hormones are secreted directly into the bloodstream rather than by the way of ducts. There is a pictorial representations of secretion of hormone into blood. First of all, there is stimulated glands with the internal secretion secrete hormones directly into the blood. Here the hormones secreted into blood and hormones through blood travel to the target cell where they are needed. The next hormones recognizes target cell of the body, and there from here the organ responds to these hormones. That's the way of traveling hormone in bloodstream. After hormones, next is endocrine glands. Some of the major endocrine glands in your body include pituitary gland, pineal gland, thymus, thyroid, adrenal gland, pancreas, testes, and ovaries. These organs secrete hormone in microscopic amounts, and it takes only very small amounts to bring about major changes in the body. Even a very slight excess of hormone secretion can lead to disease states and can the slightest deficiency in a hormone. Here's the picture given that show the different glands in our body. These are all endocrine glands, and they secrete their hormones into bloodstream. First is hypothalamus gland. They are situated in our brain and it's the size of almond. Next is pineal gland, pituitary gland, thyroid, and parathyroid glands. Thymus gland, stomach gland, liver, adrenal, pancreas, kidney, testes, uterus, and ovary. These are all endocrine glands in our body. The next is, what is hormonal disorders? These are the disorders that occur when hormones rises above or drop below normal levels in the bloodstream. There are different categories of hormone disorders. Some of two is given as endocrine diseases that result when a gland produces too much or too little of an endocrine hormones called a hormonal imbalance. Endocrine diseases due to the development of lesions such as nodules or tumors in the endocrine system, which may or may not affect hormone level. After this, what are the causes of hormonal disorders? There are different causes of hormonal disorders. Hormone level in the blood may be increased or decreased, and these causes are given as a problem in the endocrine feedback system. There is feedback system in our body that give us alarm about the level of hormones in our blood. so there is some problem with the feedback system that is the cause of hormonal disorder. Next is diseases. Different diseases have a different level of hormone. Then next is failure of glands to stimulate another gland to release hormones. Next, genetic disorders such as multiple endocrine neoplasia or congenital hypothyroidism, infection, injury to endocrine gland, and tumor of an endocrine gland cause the hormonal imbalance in the body. Male hormone disorders. The main hormonal disorders is due to the excess or deficiency of hormones. Some of the disorders in male due to the deficiency of hormones are hypogonadism and infertility. First hormone disorder is testosterone deficiency hormones. It's also called hypogonadism. Testosterone deficiency syndrome or hypogonadism is a condition in which a man's body does not produce sufficient testosterone, which is a primary male hormone. This condition generally affects older men, but younger patients can also be affected for a variety of reasons. Testosterone play an important role in man's sex drive, muscle mass, as well as mental and physical energy. If there is disturbance in the testosterone level in the blood, then these all functions disturbed. Symptoms of testosterone deficiency syndromes is reduced libido, means sex drive, or difficulty in obtaining or maintaining the erections of reproductive organs, difficulty in considering or making decisions, and that next is poor results from exercise programs, increase in body fat, loss of lean body muscles, loss of bone density, depression, poor work performance, unfavorable changes in cholesterol profile. Here's the different hormones in our body and different glands that secreted these hormones. These hormones have a role in our liver functions, muscle functions, our testicles, and libidos. The next is the causes of testosterone deficiency syndromes. In some cases, a specific cause for testosterone deficiency may be discovered. An example would be excess secretions of one or more pituitary hormones that then interfere with testosterone productions or availability. It means that pituitary gland and its hormones have effect on the testosterone productions. In most people, though no cause of testosterone deficiency can be found, in these cases, the testosterone replacement therapy is usually an effective treatment. Effect of testosterone deficiency syndromes may be different, and it may be worsened at different stages of diseases. These are the increased risk of cardiovascular diseases, means that if there is a testosterone level increase or decrease in our body, the cardiovascular diseases start. The next is the risk of death from cardiovascular events. Cardiovascular events may cause death of person. Increased risk metabolic syndrome, high blood pressure, elevated insulin level, excess belly fat, and abnormal cholesterol levels. Next is strong association with diabetes, strong association with atherosclerosis disease of aorta. The next is the drug used to treat hypogonadisms. There is a drug that is used to treat hypogonadisms or testosterone deficiency syndrome is Clomiphene. Clomiphene is the brand name of Clomiphene citrate. Doctor prescribed Clomid for men. It's usually given to men who have a low sperm count caused by low testosterone levels. Clomiphene citrate name serum testosterone levels. Here is a structure of Clomiphene citrate. The next is a mode of action of that drug. Clomiphene citrates have a mode of action that is well defined. Clomiphene citrates can be fairly effective treatment option in increasing serum testosterone levels. Clomiphene is a selective estrogen receptor modulator. This class of medications competitively bind to the estrogen receptors on the hypothalamus and the pituitary gland. Accordingly, the pituitary gland recognizes less estrogen and creating more luteinizing hormones, which escalates that starts at 25 mg every other days with an upward titrations to 50 milligram daily as needing. When luteinizing hormones and follic stimulating hormones levels are high, this medicine is not effective to treat serum testosterone level. Here is the pictorial representations of mode of actions of clomiphene. The hypothalamus has a role in the hypothalamus and interior pituitary has a role in the mode of action of clomiphene. The clomiphene bind with the estrogens and that is present in hypothalamus and have different functions. Interior pituitary releases follic stimulating hormones and luteinizing hormones. These follic stimulating hormones interact with the Sertoli cells and luteinizing hormones interact with the Leydig cells. The Sertoli cells is the cause of spermatogenesis, mean release of sperms that are mature one, and Leydig releases testosterone hormones, after which these testosterone hormones is converted to estrogen hormones. There are different side effects of clomiphene, which are given as, first one is gynecomastia. Gynecomastia is an enlarged breast in man. The next is hypertension, cataract. Cataract is a condition of infertility. Weight gain and acne is also there is also a condition of baldness, blood visions, headache, and increase of hemoglobin level. The next is breast muscle tenderness. Main infertility mean a man is not able to start pregnancy with his female partner. Man infertility can have many causes. The different drugs are used to treat the male infertility. First one is human chronic gonadotrophin. Human chronic gonadotrophin is a hormonal treatment that can also be used to increase the testosterone level in men who suffer from symptoms of low testosterone or hypogonadism. This drug is typically a last resort treatment because it requires 2 to 3 injections per week and people avoid them. The next is the mode of action of human chronic gonadotrophins, which is given as, here is a pictorial representation of the mode of action. First of one is the pituitary gland that is present beneath the hypothalamus contain the gonadotrophic cells, and these gonadotrophic cells produces follic stimulating hormones and luteinizing hormones. These hormones are glycopeptides with a molecular weight of 10,000 Daltons, and they are made up of alpha chains that is identical with that of human chronic gonadotrophin and thyroid stimulating hormones, and a beta chain that is unique for each. Follic stimulating hormone has a lower plasma concentration and a longer half-life than luteinizing hormones. The nature of gonadotrophin releasing hormones is essential for normal gonadotrophin release. A continuous stimulation inhibits their secretion. After releasing to the systematic circulation, folate stimulating hormones and luteinizing hormones exert their effect by binding to plasma membrane of target cell. Luteinizing hormones mainly functions to stimulate testosterone secretions from Leydig cells of the testicles, while folate stimulates Sertoli cells to facilitate germ cells differentiation. Here is the Leydig cells and Sertoli cells. Human chorionic gonadotrophins work in the Leydig cells, and these releases testosterone, and testosterones go to Sertoli cells. Sertoli cells do different functions and are the cause of spermatogonium. Here's the different mechanisms, but this one is the defined one. After release into the luteinizing mainly functions to stimulate testosterone secretion from the Leydig cells. So luteinizing hormones that are released has a function in the release of testosterone from Leydig cells. The next is the folate stimulating hormones that stimulate the Sertoli cells to facilitate germ differentiations. Gonadotrophin release is modulated by a variety of other signals and inhibit from Sertoli cells, which causes selective decrease in folate stimulating release. Decreased amount of luteinizing hormone production fail to initiate spermatogenesis, thus causing oligospermia due to secondary deficiency of testosterone. Use of human chorionic gonadotrophin in such patients have become routine. However, in male endogenesis, productions of Hcg does not occur and thus substitute from outside through hormonal treatments. The next is the side effects of Hcg, means human chorionic gonadotrophin. There are different side effects. Some of them are given as side effects may include the following: pain at the injection sites. This is a hormonal treatment and these hormones are injected so there may be a pain at the injection site. The changes in libidos means sex drive, and changes in mood and changes in energy level, weight gain, increased red blood cells concentration, and risk of blood clot, and there is also prosthetic enlargement. The next is female hormonal disorder. In female hormonal disorders, there is excess or deficiency of hormones. Such disorders are given as such as polycystic ovarian syndromes, also abbreviated as PCOS, and infertility in females. Some of medications are used to treat is given as, first of all, what is female infertility? The term female infertility is often used as a general term to describe a situation where a woman is unable to conceive a child. The true medical definition of female infertility is when a woman is unable to conceive after 12 months of regular unprotected sexual intercourse. Infertility can be distressing and emotional issue for both women and men. The next is the cause of female infertility. There are a number of different causes of infertility in women, and sometimes the causes remain unknown. The most common reasons why a woman may not be able to conceive a child include infrequent release of eggs from the ovary. This can happen as a result of various physical or medical conditions. This can include general illness, disturbance to hormone balance in the body, too much weight loss or being overweight, premature ovarian failure, or early menopause. Is when the ovaries stop producing eggs before the age of 40 and will require the woman to undergo some sort of assisted reproductive therapy in order to become pregnant. The next is the drug used to treat infertility. Here's a drug that is named as letrozole. Letrozole is a drug used to treat infertility in females and sold under the name as Femara. Letrozole has no effect on estrogen receptor. It blocks the aromatase enzymes for 5 days, after which the drug is eliminated from the body. This drug has a role in obtaining high rate of ovulation and treat infertility that was induced by hormonal disturbance. Here is the structure of letrozoles. The next is the symptoms of female infertility. Women have problem in releasing eggs are likely to experience infrequent or absent periods. The next is a polycystic ovary syndrome is the most common hormone disturbance for women with infertility that result in irregular periods. With this condition, some women will experience unwanted hair growth on the face and body, patchy hair loss from the scalp, and too much weight gain. Women with the endometriosis are likely to have painful and heavy periods, lower abdominal pain, painful sexual intercourse, or a combination of these symptoms. The next is the mode of actions of letrozole. There is the mode of actions of letrozole with the pictorial representations. Pituitary gland had a role in the mode of action of letrozole. Letrozole inhibits the aromatizations of androgens to estrogens. Aromatization is a conversion of androgen to estrogens. So first step is aromatization inhibition. Letrozoles inhibit the aromatizations of the enzyme, and the next is this inhibition of aromatization releases the pituitary axis from the estrogenic negative feedbacks. The aromatization enzyme inhibitors block the estrogen productions, and then after there is the negative feedback inhibition, means that there is no negative feedback sent to the brain. The next step involved is the resultant increase in gonadotrophin secretion. Gonadotrophins means follicle stimulating hormones. Then there is increase in follicle stimulating hormones. The growth of ovarian follicles. Letrozole has a short life of 45 hours. Then after this, it is eliminated from the body. Hence, the blockade on the aromatization is removed, and hypothalamic pituitary axis is given again able to detect the presence of endogenous circulating estrogen and lead to gradual stoppage of follicle stimulating hormone. This results in normal follicle growth and selection of dominant follicle and atresia of other growth follicle. The detections of endogenous circulating estrogen by pituitary axis also lead to timely release of luteinizing hormones and finally lead to ovulations, mean release of egg into uterus from ovary. The next is the side effect of letrozole drug. There are different side effects. First one is hot flushes. The next is night sweat, nausea, vomiting, loss of appetite, constipation, diarrhea, heartburn. The next drug is Ephlorinitine. Ephlorinitines are sold under the name Venica, and it's a medication used to treat excessive hair growth on the face of women during Polycystic ovary syndrome. This drug is a selective inhibitor of the enzyme ornithine decarboxylase. The eflornithine may be available in the form of cream or injection. In the cream form, this drug acts with ornithine present on hair follicles on the face and inhibit hair growth. Here is the structure of eflornithine that is given as what is excessive hair growth. If Ephlorinitine was originally developed as a treatment for African sleeping sickness. However, recently it has also been widely adopted as a treatment for excessive unwanted hair. The drug treats the ailment through the mechanism. First of all, inhibiting ornithine decarboxylase and reducing polyamine production. Polyamine production is essential for hair growth. That's why this drug will reduce the polyamine productions, and polyamine productions reduce the hair growth. In fact, our cell is growing hair follicles have high level of ornithine decarboxylase expression. Furthermore, the polyamine spermidine promote hair growth in human follicles. The next is the mode of action of Ephlonatins. The mode of action of Ephlonatine is by the inhibition of ornithine deoxycarboxylase. So let's talk about it. There are different steps in this mechanism. First of all, there is a production of Schiff base. First step include the Schiff base with the PLP cofactors. That here's the conversion of PLP cofactor into PLP Schiff base. The next step include that nucleophilic attack of Ephlonitine alpha amines, and it's a nucleophilic attack of Ephlonitine alpha amine, and this is highly activated for decarboxylation with additional electronic stabilizations and electron withdrawing difluoro group. Here's the attack of Ephlonitine drug on the PLP Schiff base cofactors and the release of decarboxylation with additional fluoride ion. After this step, there's also a nucleophilic attack by the thionyls. The thionyl do attack on the complex that formed from previous steps, and this is forming covalent bond with this material. Then after this, the Schiff-base exchange can transfer the PLP back to the active sites, and there is also the release of, there is a rearrangement in the Schiff base and also the release of next fluoride ion. Then after this, there is a Schiff-base exchange that can transfer the PLP back to the active site lysine, but the inhibitor remain irreversibly attached to the active site cysteine. Eventually, the bond inhibitors with the loss of ammonia. In the last step, here is the loss of ammonia releasing cysteine. The next is we talk about the side effect of Ephlonitins. The side effects include burning of the skin, redness of the skin dryness, headache, skin rash, and acne. Last disease is the polycystic ovary syndrome. This disease is a condition in which the ovaries produce the abnormal number of androgen, male sex hormones that are usually present in women in small amounts. The name polycystic ovary syndrome describes the numerous small cysts, fluid-filled sacs that forms in ovaries. Treatment for the PCOS is often done with medications, but there is no proper care. This disease can be controlled with the help of reduced insulin resistivity. Here is the polycystic ovary syndrome ovary. There is a lot of cysts and that are fluid-filled sacs. The next is the causes of polycystic ovary syndrome. The exact cause for PCOS is not clear. Many women with the PCOS have insulin resistance, mean that there are chances of diabetes development. Insulin level build up in the body and may cause higher androgen levels. Obesity can also increase insulin levels and make PCOS systems worsen. This system also run in families. It's common for sister, mother, and daughter to have a PCOS. The next is the symptoms of this disease. Some women start seeing symptoms around the time of their first periods. Others only discover they have PCOS after they have gained a lot of weight or they have trouble getting pregnant. The most common PCOS symptoms are irregular periods. A lack of ovulation prevents the uterine lining from shedding every month. Some women with PCOS get fewer than 8 periods a year or none at all. The next is the heavy bleeding. The uterine lining builds up for a long period of time, so the periods you do get can be heavier than the normal. The next is hair growth. More than 70% of the women with this condition grow hair on their face and body, including on their back, belly, and chest. Excess hair growth is called hirsutism. The next is acne. Male hormones can make the skin oilier than usual and causes breakout on areas like face, chest, and upper back. The next is the weight gain. Up to 80% of women with the PCOS are overweight or have obesity. Male pattern baldness. The hair on the scalp gets thinner and may fall out. Darkening of the skin. Dark patches of skin can form in bodies, create like doll on the neck and in the groin and under the breast. The next is headache. Hormone change can trigger headache in some women. There's a difference in the normal and polycystic ovary. Here's the pictorial representation of the normal and polycystic ovary. This is the normal ovary and this is the polycystic ovary with a lot of fluid-filled sacs. The next is drug used to treat PCOS. Glucophage means metformin. Metformin sold under the brand name Glucophage. Among others, it's the first-line medications for the treatments of type 2 diabetes, particularly in people who are overnight. It is also used in the treatment of polycystic ovary syndrome. It is associated with weight gain and is taken orally. Metformin increases insulin sensitivity. The next is the structure of metformin, mechanism of action. Metformin mechanism of actions are unique from other classes of oral anti-hyperglycemic drugs. Metformin decreases blood glucose level by decreasing hepatic glucose productions, mean glucogenesis, and decreasing the intestinal absorption. Intestinal absorption of glucose and increases insulin sensitivity by increasing peripheral glucose uptake and utilization level. It is well established that metformin inhibits the mitochondrial complex 1 activity, and it has since been generally postulated. After ingestion, the organic cation transporters is responsible for the uptake of metformin into hepatocytes, means liver cell. As this drug is positively charged, it accumulates in the cells and in the mitochondria because of the membrane potential across the plasma membrane as well. Metformin inhibits mitochondrial complex 1, preventing the production of mitochondrial ATP, leading to the cytoplasmic ADP, and AMP ATP, means adenosine diphosphate and adenosine triphosphate ratios. These changes activate adenosine monophosphate activated protein kinase, means AMPK, an enzyme that play an important role in the regulation of glucose metabolism. Following this process, there is an increase of AMP and ADP ratio, and also inhibit fructose 1,6 bisphosphate enzyme, resulting in the inhibition of glucogenesis, means glucose production. Activated AMPK phosphorylates 2 isomers of acetyl-CoA carboxylates and increasing liver sensitivity to insulin. Here is the pictorial representations of mode of action. The metformins work on the respiratory chains, means that mitochondrial complex 1, and it increases the level of adenosine monophosphates. After these, adenosine monophosphates do work with the pKa protein, and these converted, and these there is also no work on the 1,6-phosphofructose, and after this there is a loss of glucogenesis, mean reduced blood glucose level. The controlled glucose level due to metformin decreases the androgen hormone and increases the evolution in polycystic ovary syndrome, and reduces the infertility and maintain menstrual cycle. There is the side effect of metformin, that is stomach upset, vomiting, metallic taste in the mouth, cardiovascular risk, and weakness and nausea. Thank you. I hope you like my presentation. That's all from my side.